Well, good afternoon, everyone, and thank you, Stuart, for that introduction as well. So I'm delighted to be here with you this afternoon and to address this conference, which marks the launch of COSLA's programme of activity for the UN 16 Days of Activism to End Gender-Based Violence. And I'm particularly delighted to be here in my capacity as the Minister for Community Safety to talk about the importance of recognising violence against women and girls as a public health issue. So public health is what we as a society do collectively to assure conditions in which people can be healthy. And in a vibrant, modern Scotland, it should be possible for everyone to be as healthy as they possibly can be. And it should be the case that social, economic and physical environments that we live in will help create health and well-being, and that local communities and public services will make it possible for individuals to take positive decisions about their own health and, more importantly, also feel really supported to do that. But unfortunately, as we know, far too many people in Scotland, this isn't the case for them. And as a nation, our overall health is unacceptably poor in comparison to other Western European countries. And people living some of our most deprived communities still experience poorer health than those in wealthier countries and also areas as well. So we need to, I think, reset how Scotland thinks about well-being, how Scotland thinks about health, and this cannot, of course, be created and sustained just by the NHS alone. And as you'll be aware from discussions earlier on the day, we published our health priorities in June 2018, and the public health priorities represent an important milestone, I think, and reflect an agreement between local and national government about the importance of concerting our efforts to improve the overall health of the population. And the priorities have also brought an increased focus on the need to improve the health and well-being of women and children across Scotland. And I am clear this cannot be achieved without tackling violence against women and girls. And obviously, when we talk about violence against women and girls, we're talking about, a whole range of behaviours. So including domestic abuse, rape, sexual assault, honour-based violence, or so-called honour-based violence, including forced marriage and female genital mutilation. And unfortunately, and undoubtedly, this violence damages health and well-being, and it is a key public health issue. And that fact is recognised internationally, with the World Health Organization highlighting that violence against women and girls as a major public health problem and a violation of women's human rights. Women and children who experience this violence are at increased risk of experiencing inequality of outcomes throughout their life, including lower levels of physical and mental well-being and an increased risk of harm. The physical, emotional and psychological consequences of this violence and abuse are significant predictors of poor health and strong risk factors for poor health outcomes. And as many of you in this room will no doubt be aware, the Scottish Government is committed to tackling violence against women and girls and is implementing Equally Safe, which is our co-owned strategy with COSLA to prevent and eradicate all forms of violence against women and girls. So in order to achieve this goal, we published our Equally Safe delivery plan, and that was in November 2017. And that contained 118 actions across 4 priority areas to help prevent violence from occurring in the first place through culture and attitude change, to improve frontline specialist services and the justice response, and to hold perpetrators to account. The priorities that are in Equally Safe have a direct correlation to the public health priorities for Scotland. Both strategies promote a strong focus on prevention, on early intervention, innovation, and also on accountability. Equally Safe recognises that violence against women and girls is rooted in gender inequality, and therefore it requires a whole population approach in order to address it. And equally, the public health priorities are not solely for public health professionals. They're intended to be a foundation for the whole system, for public services, for the third sector, for community organisations and others to work better together to improve Scotland's health and empower people and their communities. And they're a starting point for a new preventative approaches and a new awareness around well-being, and I'm sure that they will develop and strengthen in the coming years. Violence against women and girls is estimated to cost the public purse around £4 billion per annum, which is quite shocking. And this issue, often we know it's hidden and sometimes it's undisclosed as well, and the statistics available probably represent a significant underestimate. This includes costs associated with medical care, medical health, substance misuse and social care needs caused by violence against women and girls, and gender inequalities that are embedded across our society. And if we look at some of the statistics in this area, we can really get an idea of the scale of the problem. For example, half of all mental health service users have been physically or sexually abused as children. Women who are subject to domestic abuse are almost twice the risk of experiencing poor mental health than women who are not exposed to domestic abuse. And we also know that gender inequality and violence against women and girls both have a negative impact on women's social, economic and political equality. And even in this day and age, statistics suggest that women are still paid an average of 15% less an hour than men. Women disproportionately bear the brunt of austerity and are also 4 times more likely to give up work due to caring responsibilities. They're also more likely to be in low-paid, part-time employment, putting them at greater risk of poverty. And this is why we need to reaffirm that violence against women and girls is a public health concern, and that we'll only succeed in tackling this and Scotland's other significant public health challenges if we ensure that there is a focus on addressing the fundamental root causes. So, working with COSLA and other partners, we are proud of the progress that we've made on tackling violence against women and girls and advancing gender equality in Scotland. And we continue to support programmes in schools that help teach children and young people about important concepts like consent and what healthy relationships look like. We funded the expansion of Rape Crisis Scotland's sexual violence prevention programme to all local authority areas in Scotland. Rape Crisis Centre prevention workers deliver workshops and modules that cover gender consent, sexual violence, how it can be prevented, sexualisation and pornography, social media, and the impact of sexual violence, and also how they can access support. We are supporting Rape Crisis Scotland and Zero Tolerance to deliver Equally Safe in School, and that's a whole school approach to tackling gender-based violence and promoting gender equality. And that pilot is in its final year, and we'll work with those 2 organisations to identify the next steps for that project. We are also ensuring that teachers and adults who work with children and young people are equipped to navigate these important issues. And in May 2019, we published a new resource for professionals to help them support young people's understanding of healthy relationships and consent. And this means that whenever a young person seeks advice, whether that's from a teacher, a health professional or a youth worker, they should receive consistent, age-appropriate information. The key messages on healthy relationships and consent have been developed as part of the Scottish Government's work on supporting positive relationships and sexual well-being in young people, and set out that relationships should be mutually respectful, consensual, positive, healthy and enjoyable. The Scottish Government has also been working with key stakeholders to review and to update the current teaching guidance for relationships, sexual health and parenthood education. This guidance was recently launched and includes a section on consent and healthy relationships to give teachers additional support on delivering meaningful learning on a key topic. And this guidance will complement the key messages that I mentioned earlier on. So there's a wealth of activity that's ongoing across government and within our schools to help educate children and young people about what healthy relationships should look like. And we will endeavour to build on the progress already made in this area as we continue to implement Equally Safe. However, we recognise that our actions cannot just be limited to educational settings, and that we must try to promote gender equality across all of our society. So last year, our Gender Representation on Public Boards Scotland Act 2018 set a statutory objective for equal representation of women on public sector non-executive boards by 2022. This year, we reached a real milestone, with women accounting for half of all board members appointed to public bodies across Scotland. And this, I think you'll agree, is a significant step. And this year we'll continue on our work to make sure there's equal representation on every individual board. We have also supported Close the Gap to develop and pilot their innovative employer accreditation scheme, Equally Safe at Work. And that is currently in the process of being piloted in 7 local authority areas across Scotland. The accreditation programme is designed to help employers enhance their policies and practices in order to address the barriers that women can face at work. And this will also enable employers to better support employees who have experienced gender-based violence and work towards creating an inclusive workplace culture that prevents violence against women. And overall, the programme should help employers make the connection that preventing violence against women starts with promoting gender equality in the workplace. And we're lucky, I think, to live in a time when our leaders are increasingly recognising the importance of the issue. Gender equality is something that's extremely close to the First Minister's heart. The First Minister obviously has the Advisory Council on Women and Girls, and that was created to provide strategic, independent advice to the First Minister to help further gender equality in Scotland. And work is now ongoing across government to implement the 11 recommendations which span various policy areas such as education, justice and health, and should help to deliver a real step change in these areas. As well as progress to advance gender equality, we are also ensuring that we are equipped to effectively tackle violence and abuse and to hold perpetrators to account. The Domestic Abuse Scotland Act of 2018 came into effect just in April this year and created a specific offence of domestic abuse covering not only physical abuse but other forms of psychological abuse and coercive and controlling behaviour. So for the first time, we can effectively tackle and prosecute behaviour that may previously have fallen below the threshold of criminal conduct. Its introduction was supported by a national public awareness campaign, and we also provided funding to help support training for over 18,000 police officers on the dynamics of coercive and controlling behaviour. But nevertheless, we recognise that the impact of this legislation is far-reaching, and we will continue to work with those who, in housing, in social work, health and schools, to ensure that professionals have the resources available to them to support a shared understanding of domestic abuse. In order to ensure that we are holding the perpetrators of violence to account for their behaviour, we have also successfully rolled out the innovative Caledonian programme, which is a court-mandated programme for male perpetrators to a further 6 local authority areas. And this means that now 19 local authorities have access to this programme. And although I'm pleased with the progress that has been made, I must stress that we are not complacent about this. Equally Safe demands major and sustained change, and we must continue to work together to deliver this change. Our programme for government was recently published and outlined a focus for the year ahead, and this includes work to improve the experience of rape and sexual assault victims in our criminal justice system, the introduction of the Forensic Medical Services Victims of Sexual Offences Bill, exploring policy options to increase access to positive behaviour change for male perpetrators of domestic abuse, and a national consultation on approaches to challenging men's demand for prostitution in Scotland. We will continue to support work to reduce the harms associated with commercial sexual exploitation and also help women to exit prostitution. Today, we published our second Equally Safe annual progress report, which contains more detail about all of the work for the next year and outlines our priorities for the year ahead. And I'd like to take this opportunity to thank COSLA and the Improvement Service for their help and for their support in producing this report, and encourage all of you who have an interest in this area to have a look at it. It's clear from everything that I've said so far that an overarching theme and focus of today is the recognition that we must tackle the underlying cause of violence against women and girls. And that's why our public health reform programme is critically important to supporting and enabling a whole system approach to tackling gender inequality, with an increased focus on prevention and collaboration to tackle the socio-economic and environmental factors that nurture and perpetuate gender inequality. However, I am clear that to deliver our reform ambitions, we need to recognise gender as integral to understanding the difference as well as the similarities in experience and the impact on health outcomes. As perhaps the most harrowing indicator of gender inequality, violence against women and girls needs to be visible as the future public health landscape evolves and increasingly drives change across our public services if we are to improve outcomes for our population as a whole. And I know this has been the focus of your conversations today, and as reform progresses and we establish Public Health Scotland, the importance of gender inequality and tackling violence against women and girls will be central to that approach. Before I close, I want to spend just a few moments focusing on the next key milestone in the reform programme. Professor McGoldrick outlined earlier today, I think, that we've commenced work to create and establish a new national public health body, Public Health Scotland, and this must represent a real difference compared to what we have today. We simply must address the deep-rooted health inequalities in our country, and it must have influence right across Scotland and with a wide range of stakeholders. It must be a visible presence, providing expertise and support and leadership to those who need it. Its voice must be heard in debates and meaningful conversations about public health and also life in Scotland. And it must be also available to communities, deploying our national assets in ways that help to embed public health thinking in decision-making and planning. And it must have a relationship with the public, the people we are all working to help. National and local government will work together to inform and guide the work of the body, and Public Health Scotland will be expected to have a stronger influence and a greater focus upstream on the health service. And I look forward to seeing local government, NHS, third sector bodies, and many of you here today engaging with the leadership of Public Health Scotland, involving themselves in conversations about how we shape the work in communities to tackle some of the really complex problems that we face. I know that it will probably take us many years to have an impact, but I expect to see these sorts of relationships building and working much sooner than that. The reality of Public Health Scotland has become more intangible in recent months, and as some of you will be aware, Angela Leach will be formally taking up post on Wednesday as the new organisation's Chief Executive. Angela brings a wealth of local government experience to that role. Alongside the priorities, the establishment of Public Health Scotland will be the most significant development in public health in Scotland for a generation. And the discussion that you've had here today will ensure that as we progress, the importance of gender in understanding and responding to Scotland's public health challenges will be increasingly evident in our approach. So in closing, I want to say that I'm proud of the progress the reform programme has made to date, the prospect of groundbreaking collaboration between all sorts of parts in the system, and I think that is really exciting. And all of this is possible because of the strong partnership that the Scottish Government has built up with COSLA on this agenda. And our collective challenge today and moving forward is to ensure that violence against women and girls is given prominence and focus in how we tackle Scotland's public health challenges, and that we make sure that we do everything we can to tackle the root causes. And I'm determined, as I know my colleagues in government, that Public Health Scotland, as the new national leadership body for public health, will drive that change across the wider system, reaffirm and commit to tackling violence against women and girls as a public health issue, and create the conditions to deliver a Scotland where everybody thrives. Thank you.